Helicobacter pylori, a resilient pathogen specialized for the harsh, acidic environment of the human stomach.
Through urease production, the bacteria creates a localized alkaline buffer to neutralize gastric acid.
Its unique helical shape and flagella allow it to swim through the viscous gastric mucus layer.
Specialized adhesins enable the bacteria to bind firmly to the gastric epithelial cell surface.
The bacteria uses a syringe-like system to inject Kage proteins, disrupting normal cellular functions. Chronic infection leads to persistent inflammation, visible as erosions and peptic ulcers during endoscopy. The host immune response triggers a massive infiltration of white blood cells to the site of infection. Vacatoxins induce large vacuoles within cells, leading to mitochondrial damage and cell death. The carbon-13 urea breath test remains a gold standard for non-invasive clinical diagnosis. Endoscopic biopsy enables rapid urease testing and histopathological examination of the tissue. Standard triple therapy combines a proton pump inhibitor with potent antibiotics to eradicate the infection. Biofilm formation serves as a physical barrier, significantly increasing antibiotic resistance in chronic cases.
Proton pump inhibitors elevate gastric pH, creating an optimal environment for antibiotic efficacy.
Microaerophilic cultivation in specialized blood agar is essential for studying bacterial drug sensitivity.
Persistent infection is a primary risk factor for the progression to gastric adenocarcinoma.
Antibiotics work by disrupting essential life processes within the bacterial cell wall and DNA.
Bismuth subsalicylate provides a cytoprotective effect while exhibiting direct antimicrobial activity.
Fecal antigen testing offers a reliable and convenient method for pediatric diagnostic screening. Fecal antigen testing offers a reliable and convenient method for pediatric diagnostic screening. Fecal antigen testing offers a reliable and convenient method for pediatric diagnostic screening.
Rising global resistance rates necessitate the adoption of bismuth-based quadruple therapies.
Successful eradication leads to the resolution of inflammation and regeneration of healthy mucosa.
Understanding intrafamilial transmission routes is crucial for preventing widespread reinfection.
Specialized staining techniques like Giemsa are used for definitive histological identification.
The adaptive immune system produces specific antibodies, though they often fail to clear the infection.
PCR-based molecular testing identifies specific genetic mutations linked to antibiotic resistance.
H. pylori evades destruction by interfering with the internal digestive processes of immune cells.
Kage-positive strains are associated with severe clinical outcomes and higher malignancy risk.
Probiotic supplementation helps restore gut microbiota balance following intensive antibiotic therapy. Anti-adhesion molecules are being researched as a novel, non-antibiotic treatment strategy.
A decline in specific antibody titers can indicate successful long-term bacterial eradication.
Development of a preventive vaccine remains a major goal in global gastroenterology research.
Loss of mucus protection allows gastric acid to erode underlying tissues, causing deep ulcers. Dietary modifications are recommended to reduce mucosal irritation during the eradication phase.
Mucoadhesive microspheres extend drug residence time, enhancing the killing of the bacteria.
Chronic inflammation stimulates abnormal stem cell activity, increasing the risk of tumor formation.
Regional variations in Kage structure explain differences in gastric cancer incidence worldwide.
Narrowband imaging enhances the visualization of early dysplastic changes in the stomach.
Zinc carnosine helps stabilize the gastric barrier and promotes mucosal wound healing.
Salivary DNA testing is emerging as a potential tool for large-scale epidemiological screening.
The transition to a coccoid state allows the bacteria to survive under stressful conditions.
Multidisciplinary consultation is vital for managing refractory cases of H. pylori infection.
Antibiotics must penetrate deep into gastric pits to reach hidden bacterial reservoirs. H. pylori infection can interfere with iron absorption, leading to unexplained anemia. A color shift in the rapid urease test provides visual confirmation of H. pylori presence.
Disruption of tight junctions increases mucosal permeability and further tissue damage.
Phage therapy is being explored as a precise alternative to traditional broad-spectrum antibiotics.
Patient compliance is the single most critical factor in achieving successful eradication.
The combination of NSAIDs and H. pylori significantly elevates the risk of GI bleeding.
Bismuth-based therapy remains highly effective even against resistant H. pylori strains.
The presence of lymphoid follicles is a classic histological marker of H. pylori infection.
Identifying natural urease inhibitors offers a new pathway for adjunctive treatment.
Dental plaque may serve as a reservoir for H. pylori, contributing to oral gastric transmission.
Proteomic analysis helps identify novel biomarkers for improved diagnostic accuracy.
Phagocytosis of apoptotic cells is necessary for the resolution of gastric inflammation.
Endoscopic ultrasound provides detailed images of the stomach wall layers and ulcer depth. Alcohol and smoking weaken the gastric defense and impair the effectiveness of therapy.
Host-genetic factors play a significant role in determining the severity of gastric disease.
The E-test method determines the minimum inhibitory concentration for precise antibiotic selection.
Infected cells release interleukin-8, signaling the immune system to initiate inflammation.
Population-wide screening and treatment significantly reduce global gastric cancer rates.
H. pylori infection may contribute to low-grade systemic inflammation beyond the stomach. Nanoencapsulation protects antibiotics from acid degradation, enhancing delivery to the bacteria.
Virtual endoscopy serves as a supplementary tool for evaluating advanced gastric lesions.
Eradication therapy can partially reverse gastric atrophy and restore acid secretion.
The gastric microbiome is a complex ecosystem, and H. pylori is its most dominant member.
Psychological stress exacerbates gastric symptoms by increasing acid production and mucosal sensitivity.
Whole genome sequencing reveals new therapeutic targets in drug-resistant bacterial strains.
Restoring the balance between aggressive and protective factors is the goal of therapy.
Proper storage of medications is essential to maintain their potency during the treatment course.
Follow-up testing is necessary to confirm eradication and ensure no recurrence occurs.
Advancements in medical research have transformed the management of H. pylori infections worldwide.